Hey there, everybody. Welcome. This is the Kim and Candace Queen Bee Club, joining you live from our new studio. And we are so excited that you're here to listen to us talk about some very important stuff.
Yes, we're all about women's health and having some fun. So I'm Dr. Kim Trager, chiropractor, yoga teacher, and
I'm Candace Lawrence, functional medicine practitioner with a background in Chinese medicine. So we've got all the bases covered.
yes, and today we're talking about bone health and what you can do about it. So let's start in because most women think that they don't need to worry about the strength of their bones and their DEXA score until they are right around the age of 50, getting closer to menopause. But that is not true at
The new research shows that at the age of 30, our bone density and all our other hormones start to go into a little bit of a teeter-totter motion.
right. And as a result, that can cause the bones to actually start to lose their strength and their structure that early, which is why all of the things that we're going to talk about, you want to be thinking about and creating habits around, really good habits around as early as in your 30s. So that then when you're in your 40s and perimenopause and postmenopause, you are going to be one strong, badass woman.
Ooh, there you go. All right. Well, listen, we want to address this in a couple of different ways. The first one is a little bit of a misnomer for those of you that have had a DEXA scan or some sort of bone density scan. Believe it or not, there are two different scores that everyone needs to know, and it's your T score and your Z score.
Exactly.
So now think about this. If you are in your 50s, the T score is comparing your bone density to those of a 30-year-old.
That's not fair.
That is not fair at all. Wait a minute. So that's the T score. That's the one that they're now presenting as the gold standard. And they say, oh, your T score is low. Well, there's also another score called the Z score.
Right.
And the Z score compares your bone density to other women in your age group. What a
A
concept.
lot more fair because it's okay. In fact, it's normal as the hormones, certain hormones decrease, that the bones are not going to be quite as strong. And that's why we're going to share with you all the tips that show how you can keep them strong. So now that you understand the T score and the Z score, you understand that actually I have some patients and they're not even given the Z score.
At all.
So I
At all.
asked them to go back and get their Z score from a doctor so that we can compare them with other women their age.
Wait, I've got one better. I've sent patients back to get their Z score, and there have been a couple of my patients that have actually had to gone to war for themselves and demand it. It's done at the same time. And these doctors are now saying, oh no, you don't need that. Well, once they get the Z score and they look at comparison with their bones and their peers, they're just fine.
Right.
They're not in need of biphosphonates.
So what we're saying is that you want your Z score and you want to be an advocate for yourself. And even if your DEXA score, even if your Z score is a little out of that range and the doctor says, this is we want to put you on meds for this. We ask that you be an advocate for yourself and ask for time to change the situation.
Yes.
Because it doesn't happen overnight.
And you say, not so fast. I've got some things up on my sleeve, and we are going to try a couple things before we start one of these biphosphonates.
So I actually, and you might even be asking, well, why do our bones get weaker? And that it's primarily hormones, but also diet and inflammation. So
The inflammation word again.
So we'll be addressing that.
Everyone.
There are like 6 or 7 different things that we're going to go over so that you don't have to take notes now. We'll give them to you later. But the first one is diet. Changing your diet makes such a difference. And we're not talking about losing weight. We're talking about creating a healing environment within your body. And that means more alkaline. One of the things that you suggest to all of your patients that they do first thing in the morning before coffee, and that is
Drink warm water with lemon juice in it. Now, it can be, as somebody says, I don't want to do a juice an orange or a lemon every morning. Great. But they do have organic in a glass jar, already squeezed lemon juice. So put like a tablespoon of lemon juice into like 8 ounces of warm
I
water.
only do a teaspoon. Is that okay?
Sure, sure. But what you want to accomplish here is when you start out in the morning, that's the first thing you do, and it takes you from being at the center, it pushes you towards being more alkaline. So you start your day over here. So then as you work through your day, and usually people get up in the morning and the first thing that they say is, "Oh, I have my cup of coffee." Well, that takes you acidic. Or
Right.
I have
Yeah.
my tea. It takes you over to the acidic side. And then you have to work your way back with alkaline foods.
So
And who
we
does
think
that?
we think that that's a great way to start the day. Now,
Mhm.
greens can also do this because vegetables, all vegetables are alkaline.
Mhm.
And that's why we also suggest that with each meal, you start with vegetables to create an alkaline situation. So diet's one of the things, and alcohol's also acidic. So that's one of the things where we say reduce
Drink early in the morning if you're going to.
and have vegetables first. So
That's why Bloody Marys are so great. They are full of vegetables.
so we can do a whole class just on vegetables and well, just on diet and
Yeah.
how we can make the system more alkaline. And we might even do that. For now, let's move right into nutrition because that is where we can actually use some supplements as natural medicine to help our bodies build bone.
Yeah. So, number one, vitamin D3, vitamin D3, vitamin D3. However, those of you that say I've been taking D3 for years, yes, but you must, the newest research shows you must take D3, K2, and a quality magnesium all at the same time
At the same time,
so that they're sending signals to each other to unlock the calcium from the tissue.
that's right.
Right. It's very important. We'll say this here. Calcium supplementation by itself is not the way to build new bone. Please, please don't listen to anyone that's saying, have some yogurt or drink some milk.
Or just take those hard calcium tablets. That is old news.
Old school.
Old school and old news. What the simple way to remember this is vitamin D, which we make from the sunshine, but most of us in the winter are not making it. And even in the summer, if you work full time, you may not be making it.
Mm-mm.
So at least 5,000 IUs of vitamin D3 with at least 180 to 200 micrograms of
Well, I'm going to go
vitamin
down.
K
I'm going to go down because most supplements that you're going to find
are
are like, they're like 100. But what the K2 does with the D3, the K2 is the important thing because the K2
right.
is the traffic cop, and it goes because the D3 goes in with the magnesium and locks the calcium in your tissue. And we're simplifying this greatly.
It helps you absorb it from food.
Yeah, so then the calcium's out here, okay, ready to go. And then the K2 is there and says, yo, calcium, go into the bone, go into the bone. If you don't
Yeah.
have that
It's
K2
like
in
a
there,
traffic cop.
yeah,
Turns out bones are boring. Calcium doesn't want to go there.
exactly.
Magnesium doesn't necessarily want to go there. Potassium, none of them want to go there. So K2 sends all of the important minerals that we need for strong bones right into the bone. And it's the magnesium at the same time. I always say it's like a catalyst. It sets the stage. So even if I have some patients, they're like, I just hate vitamins. Well, get those three in, or many vitamin D3 and K2 are combined now.
Yeah, right.
And so,
And you say, oh, well, I don't want to take too much. Trust me, a majority of everyone watching this, your D3 is low.
probably low.
Low.
And any extra gets out of the body through urine. So if you're not sure, ask your doctor to put in a script for your vitamin D test. And if it's worth paying for because they will probably say, oh, well, your insurance won't cover it. It's important to know what your number is. We'll give you some information about that.
Well, so then the results come back and you're at 31, everyone. The range is 30 to 100. It used to be, the standard used to be that 30 basically prevented rickets, which was soft bones, right? 30 prevents rickets. And people say, I say, did your doctor ever talk to you about D3? Oh yeah, they've always said it was low. Well, if you're below 30, everyone, you are compromising brain function, you are compromising your immune system.
Depressed.
You're depressed, your hair follicles are falling.
It's bad.
Oh my goodness.
And your pain. There's a lot more pain.
Yeah.
When you're not in that sweet spot of having your vitamin D3 be between 60 and 90. That's
60 and 90. That's the sweet spot. So it's going to take a while for you to get up there.
And there are just a few more supplements, like if you're looking for trace minerals to take to help you hold on to the bone, you want them to include strontium and boron. And it's nice to take that away, to have those, and they can be found in a number of different supplements, but also collagen. And collagen's big right now. People think of it as hair, skin, and nails. It's also bones and muscles.
But you want to make sure of a couple of things when you're buying your collagen. You want to look at the back of the container. You want to make sure that it's sourced from natural cows or whatever kind you want to get. You want to get it from a natural source, grass-fed, whatever, because otherwise you're technically consuming all the crappy stuff that animal ate. That's number one. And you want to make sure when you look at the back of it that it contains collagens, Roman numerals 1, 2, and 3. The more it contains, the better you're going to be and your absorption is going to be, and the higher quality it is.
And for those of you that have never taken collagen, it comes as a powder. It dissolves in water, coffee, tea. It's pretty flavorless. So that's what, that's part of the nutrition that you can add to that. And we can't move further anymore about bones unless we talk about exercise. Yeah, we have to talk about it because there is something that we learn about in school. Well, school when you're studying the human body, and that is called Wolff's Law. So Dr. Wolff discovered that the more you use your muscles and you're pushing things and lifting and weight bearing and moving, that the stronger your muscles get, and the muscles attaching to the bones naturally makes the bones stronger. So exercise is one of the key things.
And just to be specific, weight training.
Yeah, weight training.
You have to, even if it's soup cans while you're watching TV.
To begin with.
To start with.
Yes.
Right? Anything shows dramatic, when you start weight training, any amount of weight training that you do shows dramatic increases in your bone strength pretty quickly. And that is something, as we age, it's coming out more and more. We must do strength training, weight training of some sort. Yeah. It's gotta be, it's a must.
And those of you that are 65 and older, there's the silver sneakers where you can go to a gym for free during hours when they're not busy. And the weight machines are fine too, because they make it safe and easy. Just get some instruction on that. However, those of you that are not up to 65 and still have to pay for a membership or buy your weights, it's so important. And they have weights and cute colors.
It's also nice. And even what about the bands? If you are someone that travels a lot for work, get a pack of those resistance bands. Yeah. There are all kinds of videos out there, instructional videos. They are very effective, and as effective as regular barbells or dumbbells or anything like that.
So whereas movement is important, especially for the cardiovascular, I love getting on a stationary bike, or when it's nice, I love biking outside. And treadmills, elliptical, that's all great, rowing. It is the weights that really make a difference for your bone strength.
Yep.
All right.
Yep.
So we talked about food and our diet. We talked about nutrition. We talked about exercise. Those are the big three.
Oh, let's pull out the big H word. Hormones.
Oh, okay. I was going to go somewhere else first, but okay, we can talk about hormones. She's switching it up today. So hormones. So the first hormone to start decreasing mid
30s,
even late 30s, is progesterone.
Yep.
And progesterone and the estrogens are like dance partners. So when the progesterone starts going down, estrogen can cause some side effects like hot flashes
Flashes,
and night sweats and
mhm,
irritability and
dry
pain.
skin,
Yes,
and confusion and that type of thing.
because they like being together and they like having a
Right.
certain range.
But it isn't necessarily that when your progesterone goes down, the estrogens go up. That's not at all. It's just that in ratio to each other.
It's called estrogen dominance because the
Right.
progesterone drops first.
Right. But it's not that you have excess estrogen. That's what a lot of people are led to believe. They say, oh, you have estrogen dominance. And then we go off into a tizzy trying to get the estrogens balanced. And that's not it exactly. You want to try to get the progesterone back
Right.
up.
And we're in a stage right now in medicine where we have these great bioidentical hormones that are safe for women to take. Progesterone is one. It can be a liposomal
Delivery?
delivery
Sure.
in the skin. And then, other doctors, there are other ways to get it, like patches and oral. But I like the liposomal. It's a good
Hmm.
way to bring the levels up. And even the three estrogens, the two good ones, the biest. So there are liposomal safe ways of getting those, and we can note those more.
We'll put a link in the show notes about where with the ones that we use and the company that we like for that. But the biest. So a lot of people don't understand that there are actually three different types of estrogens.
Right.
There's estrone, estradiol, estriol. Now, who named those? I don't know, but
I don't know.
it's so confusing. But the one you do not want to put into a supplement is the estrone. The estradiol, simply one of its main focuses, we have this little thermoregulator in our brain. And if we have too much estradiol or not enough, hot flashes.
And estrone has been associated with breast and uterine cancers. So you would never want to see it in a supplement. So that's why we want to be also on the safe side health wise and promote the two good ones, the estriol and the estradiol.
Mhm.
Another way that we can use hormones to help us naturally is looking ahead at the adrenals and one of the jobs that the adrenals do. We know the adrenals make cortisol when we're stressed, whether it's good stress or bad stress.
Adrenaline, in case we get
Yes.
in a very stressful
Right.
situation.
However, the adrenals also make something called DHEA. Now, we don't get too concerned about DHEA. It's a precursor for hormones. However, as the ovaries start to shut down, go into retirement, I
Right.
like to say.
So the ovaries say to the adrenals, okay, adrenals, take over. And at this
We're
point,
passing the baton here.
and at this point, the adrenals are over there going, I'm already stressed to the max. You're going to ask me to do this too?
Right.
But the interesting thing, if you heard this, is that we have the hormone cascade happening over here. One thing leads to another, and we produce the estrogens and the progesterones and the testosterone. But what's required to make the estrogen part happen is this DHEA, which is made in those adrenals.
So, one of the ways we can help the entire picture, including the bones, is supplementing with DHEA. Because if a woman or anyone for that matter, but especially women, are stressed, the adrenals are focusing on the cortisol,
Mhm.
not on the DHEA. So, by supplementing with the DHEA, it's supporting both the adrenals and helping with that cascade of hormones. And yeah, I think that no side effects, but often that makes a big difference.
Huge difference. So you hear that there's a lot of active moving pieces that can go into being observant about how your bones are doing. And not once have we talked about a biphosphonate.
Right, because it is known, of course, that we need the hormones. First, they thought it was mainly estrogen to build the bones, the good estrogens. Now they're also looking at progesterone for bone strength and even some of the other hormones. So it's a much bigger picture than we thought. Yes, the bioidentical hormones can really be supported, and you do not have to wait. I have some female patients that are taking the liposomal progesterone and they're in their late 30s, just to bring it up, to balance, so they don't end up with estrogen dominance and they don't, end up with all the symptoms. So, yeah, I think that that's a good one. We'll leave information about that. Now, we skipped over, so we're going to go back because another big one, and this is so important. I hope you are all still listening, is inflammation. Inflammation in the body. So if you already have a diagnosis of heart disease or type 2 diabetes or high blood pressure,
Insulin resistance.
or any kind of irritable bowel, you have more inflammation than most. And we all have some degree of inflammation because we live in a world that is becoming a little more toxic each day, unfortunately. So, what can you do to reduce that inflammation? So, first of all, one of the things that Candace specializes in is healing the gut, because that is where inflammation starts, and therefore that's where we go to first for healing.
Yeah. And it's not, we've heard the new buzzword, the buzz phrase now is called leaky gut, or the nice way is gut dysbiosis.
Wow,
Isn't that
makes
pretty?
it sound very fancy.
I know, but it is something you don't want.
No.
So what happens is that the lining of the intestine or the intestinal wall starts to become less solid. And again, another thing, this is this is the lining of the intestine. One thing that holds these tight junctures together, we go back to vitamin D, right?
Which is why if someone is low in vitamin D, they often have gut issues.
Yeah. And it's not a matter of if you have leaky gut, it's how bad it is, really. Unless you've done something to correct this ahead of time, you have it.
Well, I know that you have reminded us several times that the lining of the small and the large intestine, it's only one cell thick, whereas the skin, we have several layers. You have other layers of skin. We have lots of layers of muscle, but with the intestine, I mean, we have to really be careful.
So, we're not going to beleaguer the point here, but know that there definitely are ways to heal the leaky gut. And the beautiful thing about this is that the gut, if you do some interventions to help the gut heal, it will start to heal in as little as 4 days. That is such a beacon of hope for people, because they think, oh, this is never going to happen. So this whole inflammation would be nipped in the bud if everyone healed their leaky gut. Honest Injun.
Yeah. So it's and you're going to include some of the supplements, because it's not just adding probiotics. I know you talk about the inside of the small and large intestine, kind of like a garden. If it hasn't been taken care of, you can't just throw seeds out there. You've got to till it and add
Exactly.
all the gardening things.
And we'll go back again. If you have leaky gut, you have malabsorption. And
you
then
might not even be absorbing the things you need.
So that another layer on top of that, which we aren't going to go into in this episode, is taking antacids. And I can assure you that taking an antacid that has extra calcium is doing you no good to heal your leaky gut.
And it's not the kind of calcium you want in it.
And it's not the kind of calcium that's going to help your bones be stronger. So another little tidbit. Calcium and magnesium, if you're taking calcium, it is not your major supplement. You have to make sure that the magnesium you're taking and the calcium, if you have some in a supplement, are at a 1-to-1 ratio, magnesium being the leader of the pack.
And usually it's a 2-to-1 or a 3-to-1, or doctors will say all you need is calcium. And we've already talked about
No,
that's old school.
No, don't listen to them.
Now, if somebody takes some of the steps that you're going to share to heal the gut, then we know that there are anti-inflammatory products that are natural that can help too, like turmeric and ginger, and that essential fatty acids.
Essential fatty acids are paramount. But again, that's another whole thing. You have to be a smart consumer, and there's a ratio of the ones that are actually absorbable and those that aren't. So again, we have to be our own best advocates about any of this stuff and really read the packages. And I know you are all really good researchers at this point. Everybody can say, what is the best ratio of EPA to DHA in my omega? What is the best form of magnesium to take? You you all know how to do that at this point. And so I encourage
We have
you.
very smart followers.
We do. And I encourage everyone to say, hey, wait a minute, because we're not going to really talk that much about biphosphonates, which are all the bone strengthening, because that they've really tricked out the market, so to speak. But in the warning label, that is, you know how they staple the
Yes.
receipt onto the bag for the prescription, before just tearing that off and throwing it away, look at it, because it says in there, warning, discontinue this product immediately if you have any jaw pain, tooth malfunctions,
Yeah.
loose teeth, anything like that.
Because they primarily prevent the bone from removing any dead bone cells. So if the bone continues to slowly add new bone cells but doesn't remove the dead ones, then that's, I mean, you can figure that out already. That's not a good thing. So if you get a fracture, it's less likely to heal because it's dead bone, but it looks good on a DEXA scan. So that's been the false way of, promoting those meds, and they should always be last resort anyway. So we want to give you all of the things that can help and probably prevent the need for that prescription. And I also added getting enough sleep, because that is when we heal.
Yes.
That means when our brain heals, when our body heals, when our bones heal. So, and in fact, what is it in Chinese medicine? You want to be in bed and asleep by 11.
11, right. And technically even 10. So every hour before midnight equals, you have to catch up, and equals 2 hours after midnight.
Right. There's a hormone that's created in the brain. It's called human growth hormone. And it's, in abundance during in childhood and teen and young adult. However, we continue to create this. It is primarily created during exercise and when you are in bed asleep or anywhere asleep between 10 and midnight. And so that's that fact right there has had some of my patients moving their bedtime back to like 11 or 10 so they can get that.
You're not going to miss anything. Trust me. As my dad used to say, nothing good happens after midnight. And we should all be asleep before that midnight. The bell tolls at midnight.
And the only last thing I was going to add is there's some new research that during this time, there's bone loss that starts before menopause and after the first few years after. And that is a time period where you don't want to be losing weight quickly.
Yes.
The reason for that is when you lose weight, unless you're working out a lot, you're going to be losing muscle mass if you're fat. And fat cells actually create a little bit of hormones. The body will see your fat cells as
They now are calling fat another organ
another organ.
because it sends the same type of signals out.
Right. So, of course, we
Yeah.
want you to feel your best. We want you to feel good about yourself. We want you to, be the weight that you feel most comfortable. However, we're saying that between like 45 and 55, do it slowly, do it in a smart way, and
Lift some weights.
yeah, lift weights, make sure that you're, go back to the food part and listen to that again. So that's kind of wraps up
Yep.
our discussion on how to naturally, build your bone.
And keep them healthy.
Yes.
Far past menopause. That's the goal, that we all exercise with weight training. And believe me, there's a lot of different acid alkaline producing food lists that are available.
Yeah.
Those are really interesting because you're going to say, what? Because it's interesting because cow dairy and dairy products are acidic.
Sugar
So
is very acidic.
right. But here are all of these practitioners saying, drink your milk every day, eat your yogurt every day. And it's making you acidic, which makes your bones less apt to be as strong as they could. Hormones, a very, very important part. Of course, the diet and the leaky gut, reducing your inflammation.
Getting those important nutrients
Yeah.
in.
And getting good sleep.
There is so much you can do because we want you to be able to move in to a life where you feel strong, you feel beautiful, you feel smart, and you feel empowered. And that's so important.
and you have incredible vitality.
Yes.
Right. So we will have some contact information down in the notes below this, and we will give you some of the links of the places that we shop, and
Thank
we
you
will.
for following us and subscribing, and
Yes.
share this with your friends and family.
And we do also have a new ebook, which is in editing right now. Just a nice little quick ebook that will give you more information. And maybe that's what you download or you send to your friends and say, hey, look at this is some information, some nonpartisan information that may help other women and understand how their bones are actually staying strong. Okay.
Thank you.
See you later.